Hello, everybody. I'm so excited about tonight. So excited about tonight. So I have got one of my sweet friends with me. She is a brand new partner with Singular. I've been on her for a minute. I don't even know how long. But I'm going to let you introduce yourself because I don't even remember what you had. I had her text me like her credentials and her title and stuff, and I can't remember it. So it's on my phone, which we're watching. So I'm going to let her introduce herself and tell you why she's on here tonight. But I just want you guys to take notes, ask questions in the comments if you have them. I'm going to let Jan facilitate all the questions. She has agreed to come on. She's an open book. She's going to tell us all these things. And this is my sweet, there's never can be too many Melissas. I'm just going to tell you. So this is my sweet friend, Melissa Carbajal. Did I say it right? Carbajal. I've been saying it wrong the whole time. Carbajal. And she is going to talk to us tonight about peptides and how to actually pull the peptide into a syringe, how to safely give injections, and talk about the difference in semaglutide and tirzepatide and the microdosing and what ml is and what mg is and what units are, all those things that we don't know. We have got her here to explain it. Honey, introduce yourself and tell them why they're seeing you tonight.
Yes. So hi. So I'm so happy to be here and to help you guys with questions that you might have. Like she said, I'm Melissa Carbajal. I am a health and wellness coach. I have a self-care sanctuary in Marietta where we focus on connecting the dots. So what that means is we do a deep dive to find out what's going on behind the scenes and what it is that's going on with you and help you correct that to educate you to live a healthy lifestyle. So in that are peptides, because truthful, sugar is the root of all evil in your health. And it's not going anywhere. So this kind of helps to negate those effects. So
that's awesome.
That's where we are.
So peptides, I mean, why? So many people like have this preconceived notion that peptides are bad for you. They're not.
No, peptides, you actually make them. We make them all ourselves. So a peptide is a short chain amino acid, and you make it yourself in your body. The difference is in different situations, you make more or less. And so one of the things that helps you to make less GLP-1, which is what these peptides are, is because you already have an excess of body fat. So when you have that excess of body fat, your body makes naturally less GLP-1, which is totally counterproductive. But that's where we are. So this allows your body to have exogenous GLP-1 to allow yourself to go back to where you were designed to be to beginning.
Mm-hmm. And lose the fat.
Right.
That's what we all want to do. Hey.
Right.
So let's talk about, so when we get these peptides, it's going to come in a vial with a syringe.
Yes.
And we're going to stick ourselves. So this is what it's going to look like. Well, something close to it.
Right. So this is obviously a different name brand because we don't have the one from XMD yet. So I'm just showing y'all this, what it would look like. So this vial, for example, is 3 ml. I'm not sure if they can see that, if it's clear.
I don't know. I ain't got my glasses on. I can't, nothing's clear to me.
Okay, so this whole vial is 3 ml. And you will see down at the bottom, so it says here that there's 0.5 milligrams per ml.
Okay.
So that's how you know kind of how much you have and the dosage. Okay. And then on the syringe has 10, 20, 30, 40, 50, all the way down to 100, and that is units. You can see under the line, oh, it's 50. This is 50 units.
Can y'all see that? Everybody see it? Okay.
Okay. So The one thing that you're gonna note when you yourself are giving yourself an injection, it's gonna come with this little lid on it, maybe a different color, right? But this little plastic lid doesn't allow you to put a needle in, okay? This is one that's already been opened, and you can see that there's just a rubber center so that you can get a needle in it, right? So to get this lid off, you literally just pop it off. That's it.
Hmm.
Okay, and then that'll expose the little rubber center for you, okay?
Cool.
Okay,
All right.
so I myself, I'm already on tirzepatide, so I waited for my injection for this so that they
Okay,
can
tell
say-
us like your results, like tell us what you have felt and all that kind of stuff. I would love for them to hear your story with these.
Oh yeah, so my story is long, very long, and
Well, give us the short version.
yeah, the short version is here's my before and after. Well, you see my after, but let me show you my before.
Oh, Lord. Girl, you look hot, Mama.
155 pounds.
Woohoo. Wow.
Yeah.
And how
155
long
pounds.
have you been on it
It's
for?
so tirzepatide is not the beginning of my journey. I truthfully went to Mexico 3 years ago and 4 years ago and had gastric bypass surgery. 8 months later, I was diagnosed with cancer. When I was diagnosed with cancer, I had a complete hysterectomy and immediately started gaining all my weight back. So,
Fun.
yeah, I was really mad, and I said, "I did not come this far just to come this far. This is not happening, guys." And that's when I put myself through school, and I became functional medicine certified and hormone certification because my weight was all hormonal.
Mm.
So that's where I started my tirzepatide journey.
Wow.
After of my 80 pounds, I gained 40 of it back.
Oh, Lord.
So that's okay. I'm now at 155 days.
Yeah, baby. Good job. Yeah.
So
So why did you choose tirzepatide over semaglutide?
so I started with semaglutide.
Okay.
Truthful. I
Mhm.
started with semaglutide when I very first started, and I started at a weight loss clinic.
Okay.
Because at the time I wasn't certified to be able to do it myself. And I had to have a doctor and, be able to do it through a program. I paid $5,600 for my first program.
Holy moly.
Mhm. Now that was a year program, but that was with semaglutide. And truthful, the semaglutide didn't really cut it for me. So semaglutide is one sugar receptor. Tirzepatide is two sugar receptors.
Okay.
So it's double the powerful. Some people respond differently. Tirzepatide is more for the active part of weight loss, and semaglutide is more for a maintenance
Okay.
plan if they both work for you.
Okay.
But it's going to depend on how much fat you already have in your body. It's going to depend on how your metabolic system is already performing. Because when you're in severe metabolic syndrome, semaglutide's not enough, honestly.
Okay.
Because yes, it is helping you with that one sugar receptor, but the sugar receptor that is in your brain is not what's turned off with semaglutide. So semaglutide is more for somebody who is struggling with how their body works with sugar, and tirzepatide is more mental, right?
I fall in the mental category.
Yeah. So the semaglutide just doesn't take away those cravings.
Okay.
Doesn't for most people. I mean,
So
obviously
so when
there's-
you were on the semaglutide, like what did it keep you from eating? What did it how did you lose the weight on the semaglutide?
So semaglutide, I only lost weight for probably about the first 2 months.
Okay.
And then it never helped me after that. And what it did for me, it made me feel fuller faster.
Okay.
So I was able to
Eat
kind of
less.
eat less,
Mhm.
but it didn't take away those cravings.
The food noise.
Right.
Okay. So if someone were to start on the semaglutide and they experience the same thing, it's okay to switch.
Totally
Okay.
okay. Many times, honestly, that is the best way to start.
Okay.
Because you don't know if this is your very first time, you don't know how you're going to react. You don't
Mhm.
know how you're going to respond. I would say be truthful with yourself about where you are currently. And you make that choice, obviously, with the telehealth doctors.
Mhm.
But you can go into that telehealth appointment kind of already having an idea of what you want, right? And that would be based on, do I have excess stored fat? Do I have food noise? Am I struggling with the mental aspect of
Mhm.
losing weight? Or is it just a physical something for me?
Okay.
So just be truthful with yourself to know where you're going to start. And then I will tell you, you are going to have to what's called titrate up. So you start with a very small dose.
Like microdosing, maybe.
So no.
Okay. No. Okay. No, never mind.
Let's-
Sorry. Okay. We're not too microdosing yet.
Yes.
Cut. Sorry. Shut up, Melissa. Okay. Go ahead.
So first, you have to start with a very low dose to titrate up, and that's just to get your body used to being able to handle the medicine itself.
Mhm.
And what happens if you don't titrate up? That's when you hear all of these horrible things about GLP-1s that people are saying, that you lose muscle on it, or it's making people constipated, it's harming their gut. All of these things that people say about GLP-1s and the reason that you shouldn't do GLP-1s and it's cheating and it's bad for you, it's because they're abusing it and they're not doing it the right way.
Too much, too fast.
Right.
Mhm.
So if you're titrating up, you're going to take 3-4 weeks to get up to the next dose, 3 or 4 weeks to get up to the next dose. And this is a long-term journey. Nobody should be prescribing or getting tirzepatide or semaglutide thinking that this journey is going to be less than 12 months.
Mm.
If you do, you are doing yourself a disservice.
Mm.
So that's a good thing about the whole program, the XMD, is if you go into this telling your people ahead of time, this is a 12-month journey,
Mhm.
you're already knowing that I'm going to be making commissions for 12
12
months.
months. That's awesome.
Right. Because you just need to verbalize that to your people that this is not something that you do for 3 months and you go away, right? Because you're in training your body for this 12 months. You're going up and maintenance, and then you're coming back down.
Oh.
Right? Because you don't ever want to stop a GLP-1 cold turkey, ever, because you're going to make your body dependent upon this GLP-1. And then if you just stop, then your body's going to be like, hey, where was that? No, oh, I'm hungry.
Mm.
Right? So
Enjoy
it's
that.
going up, across, and then back down so that your body gets used to making it again.
And can keep the weight off.
Right.
Which is our goal. Okay. So talk to us about microdosing then.
Okay. So microdosing. So just like, I told you to try trade up to alleviate those symptoms, right? Microdosing is for people who can't really stand the whole dose. Because it's real. Some people have a weak stomach. Some
Mhm.
people are more susceptible to medicine. Some people, it just affects them more.
Mhm.
So me personally, I don't microdose. I would forget if I had to microdose, honestly. So, but there are people who love microdosing, and that's wonderful for them. But so microdosing is, let's say we were at 100 units. So that's 1 ml. So if we were at 100 units, we would microdose at 50 twice a week, or 30 3 times a week.
Oh, so it's still doing the same thing,
It's
except for
exactly
you're
the same.
doing, instead of doing it at one time, you're doing it more frequently
Correct.
with less amount.
Right.
So maybe instead of 1 shot a week, you would do 3 shots a week? Or-
Normally, you would microdose twice a week.
Okay. Interesting.
Yeah.
Okay.
And it's just extreme if you did 3, that you are extremely sensible to the medicine. If you're way sensitive, then you might break it up into 3. But normal microdosing is 2 shots a week instead of 1.
Interesting. Okay. Learn something new every day. Look at that. All right, let's see how to do this shot.
Okay. So number 1, this
You take the
vial-
orange things off.
Okay.
Okay.
We're gonna have this vial is pressurized. Okay. So what that means is I personally am at 1 ml. That's my level. Okay. What you need to know is that you need to pull the syringe before you stick it in to your desired level. Okay. And that's because we're going to put in here the amount of air that we want to pull out.
Okay.
So that we keep the same pressure. Okay. So I'm just going to, just put that much air in. See how it's under pressure? It's coming back out on its own, right? That's the pressure. You flip it over and it's going to fill itself back up.
Wow, look at that. That's pretty awesome.
Now, peptides, because they're short chain amino acids, they're a little fragile. So you don't want to do it fast and you don't want to do it rough. Okay. So that's why it kind of goes on its own. And then you can just kind of coax it if it's not super fast, but you never want to pull it like really, really fast and rough. Okay. Then when it comes out, if y'all can hear it, I don't know. It kind of like bubbles a little bit.
Yeah.
Okay. So then here is my syringe with my trizepatide in it. And now you want.
Why is it pink? What makes it pink?
So this has vitamin B12 in it.
Oh, it does
already.
Okay.
All
right.
And so when you're gonna give yourself an injection, I personally do my lower stomach because I don't have any feeling in my lower stomach.
Oh, nice.
Right.
Okay.
It's numb.
Okay.
But you want to give yourself this injection where you have fat, where you can pinch it. It's really very just like one little bee sting, like just a.
Where are all your options of giving yourself injections?
Okay, so this is what's called subcutaneous, meaning just under the skin, right? So you want to pick a fat part, not a muscle, right? Like intramuscular is when they give it to you in your butt cheek or in your thigh.
In your arm,
So
arm.
right here in your arm, you can take semaglutide, but you want to give it to yourself in the back fatty part of your arm, if that's what you decide to do, not in this muscle part, right?
Okay.
You can do the back fatty part, but you don't want it in a muscle because it's metabolized differently. Okay. So you just want to pick up some
love
skin.
handles.
Yeah. Usually your belly is the number 1 spot for it. Okay.
Yeah. I already have anxiety.
So I'm going to show y'all this. So fat and all. Okay.
Girl.
All hanging out, right?
No judgment here, y'all.
Right. Okay. So you just want to pick a spot. If you kind of squeeze it, then you don't even feel it. Okay. And you'll just go super slow.
That doesn't hurt?
Not at all. I don't feel it. But it doesn't hurt. That's it. No blood, no nothing.
Wow. Is anybody squeamish? Okay, good. Don't look, Ethel. Don't look, Ethel. Okay, so what do you do with your needle when you finish?
So because I have a clinic, it's kind of different for me, but for you guys, you'll, there are sharp containers that you can buy on Amazon, 3 for like $20. I always recommend to everybody at my clinic that you just get, rinse out one of your laundry bottles, the hard plastic laundry bottles, the soap or the, fabric softener.
Oh, yeah.
And then you put it in there, and when it's finished and it's all filled up, you duct tape the lid and write on a Sharpie sharps, and there's tons of places you can drop them off like that. Once they're in a hard plastic container and they're labeled sharps and the lid is taped on.
So there's places you can take it, so nobody knows.
Mhm.
Interesting. Okay.
There's lots of communities that have like sharps days where, like, you know, they recycle medicine and all that kind of stuff, and then you can drop off your sharps.
Okay. So, is there questions, Jan?
There are no questions written in here, but does anybody have a question you can unmute and ask?
I've already forgot what I had. I had a couple of questions.
You had a question about microdosing, difference between
I have a
and
question.
Okay, I hear a question.
It's Athena. I have a question.
Okay.
So what will be the difference between the injectable and the oral? Will the oral be as effective, or do we know that, or whatever?
So the normal, I mean, obviously we haven't taken this new one before, so we don't know, right? But the difference is how it's metabolized in your body. And normally the injectable, because it goes straight into your bloodstream, just gets into you a lot faster and more bioavailable than a pill would be, because of how it's absorbed into your skin and or absorbed into your body and metabolized. Like, there's a, depending on the amino acid that it is, if it's protected in fat, so your body would absorb it as fat and use it. And then also when you have to think about it going through from your stomach to your gut and then into your intestines, when is it dissolved and when does it have still that protective outer coating on it? There's people that have a gallbladder and people that don't have a gallbladder, and that affects everybody's ability to take medicine and receive the effects from it. Even supplements that we take on a daily basis. People that don't have a gallbladder, their gallbladder is empty, right? You don't have a gallbladder, so that line or hose that used to, so normally if you have a gallbladder, it constricts when you eat, and then it would dump that fluid into your stomach, and that's the bile to help your food digest. When you don't have that gallbladder, that bile, every time it's made, is just dumped into your stomach. And so that's why a lot of people have a hard time digesting their food after they don't have a gallbladder, is because sometimes when you put food into your stomach, there's bile there to digest it, and sometimes there's not.
Wow.
So sometimes you might run to the restroom as soon as you eat because there was a lot of bile there.
Interesting.
That's the difference between how a pill would work versus an injectable. An injectable is much more determinable and much more quantable of how it's going to affect you, as opposed to a pill.
Because you know exactly what it's going to do and where it's going to go and how fast it's going to get there. Okay. That
So I
makes
got
sense.
a question. I
Okay.
thought we were getting drops instead of pills for the orals. What would the difference in that be?
No, it's pills. I'm pretty sure, isn't it pills, Jan? Yeah.
Yeah,
It's
that's what I've seen is pills.
Okay. I heard drops.
Dissolvables is what they're calling them.
Yeah. She's
I've
never
seen them.
drop. I don't even know they have make drops.
So I've never heard of it.
No.
So someone did ask the question, so needles will come with the product, which I'm assuming that they
Yeah,
automatically
I
do.
actually verified that with Sarah. Yes.
I
Okay.
have a question. Oh, go ahead.
Okay, I was gonna say, I have a question too. So what if someone is already on a peptide or semaglutide or tirzepatide, and they're already using one pharmacy? if they go to XMD, will they have to start at a different dosage because it's a different pharmacy, or just
No.
talk to the telehealth person, or what do we
Right.
do?
You should be able to, because they're all compounded.
Mhm.
So just like if you, it should be exactly the same. If you
Okay.
go to get your medicine for high blood pressure at CVS or Walgreens, it should be exactly the
Okay.
same thing. So just because it comes in a different bottle with a different label, as long as the milligrams are the same, it's still compounded to exactly the same formula.
Perfect. Okay, Jody?
Okay, so I actually have two questions. So I'm taking a trizeptide, but through a different telehealth, and I obviously will be switching over to ours. And I give my shot in my outer thigh. Is that okay? Like my upper part of my thigh?
As long as you can pinch fat.
Oh gosh, yeah, I can pinch fat. There's fat there. Okay, and my second question is, I have a potential customer that asked me this. She's currently going through a weight loss clinic, and they are prescribing her phentermine and topramate. Can you tell me the difference or the benefits between going that route or going with the peptides? Do you have any idea?
Raw and unfiltered?
Can-
Phentermine?
Can she be real on here? We ain't gonna, nobody's gonna turn her into compliance, are
No,
they?
no, no, no.
Go
Yeah,
ahead.
no.
Okay.
We all real. Go ahead.
So Topamax is going to be 100% completely unnecessary with a trizepatide, not necessarily semaglutide. Topamax, what it does is it's best at night, and Topamax is designed to help you with the addiction part of food noise, right? So that helps you in the snacking at night. That's what Topamax is good for.
Well, she's actually not doing the trizeptide. This is something that she's doing completely different, and I'm trying to convince her that the
Right.
peptides are better for her than doing phentermine. And she called it topermate, like TOPERIMATE.
And generic and
Oh, okay.
name
Mm.
brand. So,
Okay.
and I'm just explaining to you what they are so that we can discuss how they work and what's the difference, okay? So Fenterman,
Ah,
Fenterman, Honest is legal speed.
oh, okay.
Fenterman is legal speed. Do you, it's harmful to your health, heart health. Is it more harmful than being obese? No, unless
Okay.
your heart is already compromised. Can everybody stand Fenterman? No. Some people feel like their heart is pounding out of their chest. And why? Because they've just done a dose of speed, honestly.
Wow.
People, a lot of times, if they're on Fenterman long term, it has proven to be a gateway drug for other later dopamine chasers.
Wow.
Okay.
So that part of it is very scary, the Fenterman part. Now, Fenterman gives you energy right away.
Mhm.
Fenterman does stop the food noise. The difference between Fenterman and a GLP-1 is Fenterman actually cuts the communication. There's a nerve that goes from your stomach to your brain, and Fenterman turns that nerve off. Okay, so your brain can no longer hear that you're hungry.
Mm.
Okay.
Mm.
Fenterman also has the same effects, the same side effects of nausea, vomiting, all of that stuff that a GLP-1 could have. The difference is Fenterman is 100% completely synthetic, right? Your body already makes GLP-1. Your body already knows what to do with a GLP-1, and you can titrate up and down off of a GLP-1, whereas Fenterman is all in or nothing.
Mm.
Right? So the fact that she's taking a Fenterman, she is not going to be able to easily wean herself off of that and her body make that again, because That's literally cutting the communication of that nerve. It's not dealing with the root cause of why you're actually needed to begin with.
Interesting. So I was prescribed Topamax for migraines. I used to take Topamax for migraines.
Mhm.
I didn't know that was a way. Wanted to work for my weight loss. I don't know. So interesting. Does that answer your question, Jody?
Yeah, yeah, absolutely. Thank you.
Awesome. All right. Anybody else?
I
I
have a
got-
question.
Who was that?
You want to go ahead?
Jerry, go ahead.
Okay. We had talked about this with the tirzepatide. Have you noticed it helping you at all? If you had any, but so many people have talked about it helping with inflammatory type things like joints and things. As we're older now,
Mhm.
we hurt. I have osteoarthritis really bad, and I just have, I take all kinds of supplements, but I don't like taking any kind of prescription drugs or pain drugs or anything like that. And I refuse to have any more surgery. So does it help?
Yes, you're going to see immediate difference in your face. First and foremost, you'll see your face because all of the inflammation is going to be gone. All of the inflammation is going to be gone. That is one reason that people start moving and exercising more when they're on it, is not because it gives you energy, but just because it makes your body not hurt, right? The inflammation is 100% completely gone.
Wow.
It is amazing for inflammation. Absolutely amazing.
Woohoo.
But you only get that with the tirzepatide, not the semaglutide.
Right. This tirzepatide. That's what I'm going to push with some of my older friends like me. That sounds great.
So in that case, you would probably look for, if they are using it for that, you would probably look for in an older person and somebody that's looking for the release from the inflammatory problems at a microdose instead of the whole shot at once. That's going to help the inflammation process more.
Really?
Mhm.
Okay. Okay. Thank you. Thank you.
All right. Next.
So Corey is asking, why is microdosing cheaper if it's the same amount? Split up
So-
over.
Saying that the microdosing, so if you're probably what they're going to do, honestly, as a telehealth, is they're only going to prescribe you microdosing if they're going to prescribe you a lesser amount, like she was just saying for her older friends who need it for inflammation. Then they're going to prescribe you a microdose, and they're probably going to just prescribe it for less than they're going to prescribe it for actual weight loss to,
So all of our microdosing have other things in it. So some of them have NAD, some of them have B12, some of them have, what is the other ones? There's like 5 different things in there.
brought them all.
Oh, she brought them all. You already know. Oh, she's got them all. Never mind. Can you tell us what those are?
Yeah. Okay. So NAD, obviously
Yeah.
y'all know what NAD is. I don't know which ones that they're going to offer to
Hang on,
me.
I'll tell you. One of them starts with an I. One of them starts with, do you
It's
have?
Moreland,
Yeah, give me a second. I'll pull them up.
Hang on, Jan's gonna tell us.
and I brought these for you. And
Y'all don't even understand. She's got like this chart. Y'all don't have a clue how many peptides there actually are. There are so many peptides out there. So this XMD that we've got, the opportunity to expand on this, I am so excited about it because I think we are just on the little brink. We have just gotten a little bitty taste of this. And I already have heard that like next year, they're already planning on other ones. So how exciting is that? So hang on a second. She's going to go ahead, Jan.
Okay.
I brought you
So, whoops, where to go here? Okay, so the first one, it is for muscle energy, and it says, well, it says tirzepatide plus NAD plus L, carnitine, and B12.
that's what's in mine.
Okay, that's what's in hers. That's what she's saying.
Okay, and then the core is GLP-1, B12, methionine, methionine, plus inositol. I'm terrible with pronouncing these. Inositol and choline chloride. And somebody told us that those that combination of those four is it's like liposuction.
So
Does that make
that,
sense?
so that, the last one that you said, that you call it NAC, NAC, N-acetylcholine. And NAC is good for so many amazing things. It is actually one of the things that's on the chopping block from our government.
Yeah.
And it's on the chopping block from our government because it's magical.
So that's the core. And somebody said they were surprised that we were able to get that in our product
Right.
because they can't in other companies.
Mhm.
Okay, then the other one is the glucose control, and that's tirzepatide plus inositol. Is that how you said it? How did you say that?
Mhm.
Okay,
N-acetylcholine, NAC.
inositol. Okay.
So, but it's
Um,
acetylcholine. So you're reading it as two separate things, but that's one thing together.
that's one thing. Okay.
It's
On
not-
this chart, it has on the core, it has them separate, like it has inositol plus choline chloride. So.
Hmm.
And I'll send this to you, Melissa, and then actually, well, you can't because you're on your phone, but then you can look at them afterwards. And then the last one is energy plus mind microdose, and that's GLP-1 plus B12 plus NAD. Well, I guess that's just those three. So.
Okay, well, I have a question. So
Basically just-
what if somebody is doing a full dose of tirzepatide? Could they do a microdose of one of these other ones as well, or no?
No, because they all have the ones
They
that
all
you
have
just
the
read,
GLP
they have the GLP-1.
And GLP, you can get them with GLP-1 and GLP.
Mhm.
Yeah, so,
Mhm.
so you wouldn't do both. You just,
No.
okay.
So Corey also asked, so do you know if they'll eventually offer these compounds in microdosing? So on the tirzepatide, you said you go up to your full dose and then you just come back down to it? And would there ever be a time that you stay on it?
So yeah, you will stay on it until you're at your goal weight. So like I said, you go up and then you stay here. And then when you're at your goal weight, that's when you start back down.
So
So
when I hear
actually-
people
I'm
say
sorry.
that when I hear people say that they get on it or they've been on it for 3 years or so are they saying that like if they start to gain weight again, they pop back on and take another shot, or they just take small amounts of it, or how does that work?
So they're probably on a maintenance dose if they've
Mhm.
3 years. So like me, for example, at one, right, 1 liter, 1 milligram, 100 units, they're probably staying at a 0.5 or 50 units, right? It's a long-term dose, but a much less because they've made it to where they want to be.
And they just do it to keep the inflammation out and keep the weight off
Right.
and keep the food noise down?
Yep.
So is there any time limit that, can you stay on it forever? Is it?
You literally can stay on it forever. You literally can stay on it forever.
if you
It
want-
is not bad for you. It is actually absolutely amazing. There's so many studies, like they're talking about how wonderful it is right now for sleep apnea.
Wow.
It's one of the most greatest things, right? But the problem is the GLP-1 tirzepatide isn't doing anything for sleep apnea. It's not helping sleep apnea at all because sleep apnea is a condition in your neck with the excess fat. What it's curing is obesity.
Mm.
But when you cure obesity, you're curing so many different things, right? I mean, your heart is better, your thyroid is better. There's the list of possibilities is endless, what you can cure with curing the obesity factor.
Alright. Interesting.
So I
Very,
Good question.
So, me too, after you, Vicky. It kind
Okay.
of went with what we were just talking about.
Yeah, the GLP-X, while we're taking it, it helps increase our GLP-1. Taking these peptides, does it help increase your peptides? Like, I doubt I'm making any. Does it help you do it on your own at all?
I think what she's saying is like injecting the GLP-1, does that help increase your own production of your GLP-1 hormone, or would you continue to take the GLP-X to do that?
Yeah, so that's gonna be completely up to you and what you can tolerate and what you feel good doing. I took a drink for a long time that helped increase my GLP-1. And I loved how that drink made me feel, and I didn't stop it until I felt like it was okay for me to stop it. I don't drink it anymore. But in the beginning I did, just because I loved how that drink still made me
Same
feel.
thing like our GLP-X.
Right. But what you will have to kind of gauge for yourself and see how you are affected by it. That GLP-X, because it increases your GLP-1, you're going to have, like, maybe if you were at a 0.5 dosage, it might feel like a 0.7 to you. So in the very beginning, when you're titrating up, right, if you're taking that GLP-X to increase your GLP-1, that dosage might be skewed for what you really honestly need, because you're exogenously increasing it, right? So I would recommend in the beginning, you kind of hold back for the first couple weeks to see how you feel with that, so that you get the right dosage. So while you're titrating up, because if you get too much, you're going to feel nauseous. You're going to feel like a little woozy if you do too much too fast.
So the importance in doing the nutraceuticals along with the pharmaceuticals. Talk about that a little bit, like how.
Can I ask a second question before I forget it?
Okay.
You were talking about, you see it in your face first. I know some people, it just sucks everything out of their face. What can we do to prevent that from happening? Or is there anything you can do to prevent that from happening?
So that is, the tirzepatide is never gonna suck your face down, right? The reason that some people feel like that, some people get droopy, is because their face has been held up for so long by fat, right? And they've been kind of inflamed for so long that their skin is a little stretched out. You know, you had chubby cheeks before. Now that this inflammation is gone, now that the fat is gone, that's going to go somewhere. But what you can do to prevent that is making sure that they're taking collagen at night. Make sure that they're getting all of the things that they need to have so that their skin is fed how it needs to be fed, so that they're as healthy as they can be, from a mitochondria standpoint or a cellular health standpoint, instead of just losing weight and not being cellularly healthy.
So like our Genesis, which is cellular regeneration, our NAD, which is cellular regeneration, protein, spring, which is hydration. That's exactly what I was about to have her talk about. And I know somebody else has got another question, but talk about like how important, like, and how unique it is for us to have the combination of pharmaceuticals and nutraceuticals to combat, all of those things.
Right.
Like,
so, when you're talking to somebody, you can't just leave it alone at the pharmaceuticals, because you're doing them a huge disservice. You have so many tools in your tool belt to be able to help them, so that this is a lifestyle instead of a 3-month journey, right? So you have the ability to educate them from the very beginning about the entire symphony that is, a weight loss journey, because it's not just you're going to stop eating and it's magically going to lose weight and you're going to feel amazing and wonderful and all the things, because then you are going to have, the side effects that the world is talking about with the GLP-1, with muscle loss and, saggy skin, and, they call it the Ozempic butt, where your butt just falls down. You still got to move, you still got to have protein, you still got to have collagen, you've still got to have all of the things. A lot of people who are overweight, and I can say this, y'all saw my picture, right? I can totally say this from my own self. I went personally, when I first lost my chunk of weight, I went to a dermatologist because I wanted fillers, because my face fell. And she told me no. She told me no, there was nothing she could do for me.
wow.
Because that was just how my face was, that she took out this ruler and measured from my cheekbone and all of this kind of stuff. And she was like, it's not going to help you.
Wow.
And there was nothing I could do about it. And I was like, what? But, you know, collagen and feeding my body what it needs with protein and all of that, I don't need it.
Mhm.
I don't need it.
That's awesome. So yeah, nutraceuticals, that's one thing that you guys have got to, you've got to talk about both. You can't just say, I'm gonna, I want you to, get on a peptide. You've got to give them the other part of it. That's what makes Zingular so unique. That's what makes X and D. We're the only ones that combine the two, where we've got all of the nutraceuticals and the pharmaceuticals too. So and look at her. She's coming to Zingular. There's obviously something that we've got to make, her who's been doing it forever, Melissa wants to be a part of what we're doing. That's exciting, you guys. So that's really exciting. What's the other question? Somebody else had a question.
So do you know if people with chronic kidney stones would benefit from peptides?
That's totally going to be up to, your doctor, and that's really a medical question to be able to ask, but it's not going to create kidney stones. And it shouldn't aggravate any kidney stones. That is not a side effect of a GLP-1. And you're going to actually want to drink more water on a GLP-1 because it makes you thirsty. That's one of the first side effects that you're going to feel, is you're going to be thirsty. So just the simple fact that you're going to want to drink more water is probably going to help with the kidney stones anyway.
Interesting.
Mm-hmm. When you put your body back to where it was designed to be, all of those things, the underlying issues are going to be going away on their own.
Nice.
Mm-hmm. With the right support.
All right, what else we got? And then we're gonna let y'all get off here. Let's do 2 more questions.
Well, I was actually going back and forth on the macro, or starting on the macro dosing or the micro dosing, but you said that they probably won't prescribe micro dosing if you have like a lot of weight to lose. And my question was actually, do we think Zingular is going to offer, because offer the macro dosing like combinations in a micro dose at some point? Because I was interested in the macro or the micro dosing because of that lipo one.
Me too. Now.
But they're probably going to put me on a macro dose. So do you think that we would, I don't know, maybe you do macro dose until you get close to your goal weight or hit your goal weight, and then you do the lipo? But the
That's
lipo
a really
one
good
is
question
like,
for your doctor. That's a really, really good
yeah,
question for
The
them.
telehealth.
I
Because
wish it was
can
in the
go in with
macro
one,
dose.
you can go in with one order and then change it. So if you go in with, let's say that it recommends a tirzepatide, and you go into the doctor, and as you're talking to him, you say just what you said there, and then they say, yeah, let's switch you over to that, to the microdosing.
Or
So
what happens if the telehealth doctor, if you don't ask, the answer is always no. What if the telehealth prescribes you the full dose like she's got with the
that's what I was saying.
other
Like,
stuff?
what are you gonna do when are you switching over?
Are you switching to Zingular?
Yeah.
Yeah, she is.
well, and
So then
that
you would have to give up your combination. That's what I'm wondering.
You can have things added to your tirzepatide too. So if you're having B12 and NAD and all those things, you can add those to your tirzepatide, so right? Did you guys know that?
Oh, okay.
That's what I've heard.
Oh, okay.
Yeah.
Okay, that
And those
makes
are
sense.
supposed to
So
be,
we
so
do the
there's gonna be a
macro and then
list.
add.
Yeah, so if you want those things in there,
Wonderful.
check them or write them down so that when you talk to them, you can.
Okay, so that answers my question, that it probably can be added if you want it.
Right.
Okay, yay.
Really?
Thank you, Jesus.
Good
Woo.
All right, one more. Who's got the last question? Make it a good one.
Can I have one more?
No.
Yes. Then mine's real short. If you order for 12 weeks, will they automatically change a prescription as to making it more each month or something like that if you do a 12-week order to start with? Or how does that going to work?
So no. So you'll probably, what I heard from you, right, is they're going to send it out in 4-week increments. So you're probably going to have, when you're titrating, you'll have to have a check-in with that telehealth doctor. They're not going to talk to you once and then not talk to you again for 90 days. Even if you did a 12-week plan, you're going to have a check-in so that you're titrating up and getting up to where you need to be.
Because there was no extra charge for more. Like they're not going to charge you more of your doses more.
Right. I just didn't know if you ordered 12, signed up for 12 weeks to start with each month, if it would change dosage automatically or.
Have to have that check-in with the doctor. They'll probably check in before they send the next month out.
Okay, perfect.
All right.
I mean, that's
That makes sense. Yeah, that makes sense. We'll find out. We'll find out. I guess we'll find out all that on Tuesday.
Yes.
Over the next couple of days. So that's something that we'll definitely need to look into. So I guess, I mean, Jan, what you got?
I don't think I have anything else, but this is very, very informative. And so thank you so much for taking your time and sharing with all of us and sharing your knowledge. I know I've learned quite a bit and I'm sure other people have too. So thank you so much for hopping on here and doing this for us.
You're welcome. I was glad to be here.
Yes,
All right.
thank you.
Okay. I love y'all so much. And tomorrow night, don't forget, we've got our professional Zoom at same time every night. Okay. Tomorrow night's a different link though. It's not on this one, but Monday night is our work Zoom Q&A. So bring all your questions Monday night to this Zoom. And then Tuesday night will be the YouTube live. So make sure you're inviting people and doing all that. Let's get loud like we've been saying. Love you guys. Have a great night.
Love you. Bye.
Bye.